I understand, obviously, without mentioning any names, you have several patients under the treatment for Crohn's.
Yeah.
So tell me their story.
Crohn's disease is really near and dear to my heart because I've had some crazy cases where we couldn't figure out what was wrong in some young little girls, and it ended up to be Crohn's disease. It presented as different things, and I was talking to one of the infectious disease doctors about this the other day. Do you see this? Because a lot of them came in with what we thought was an infection, but it ended up to be Crohn's. And yes, it's just so much widespread inflammation that it causes a big variety of symptoms, and some people go undiagnosed.
Exactly. Let's look at some of these symptoms and talk about it so that our viewers can understand a little bit more what to look out for. Belly or abdominal pain, often in the lower right area.
Mm-hmm. Yeah, so a lot of times people have diarrhea. Generally it's not bloody, but sometimes it can be, especially if you've been going through a Crohn's flare for quite a long time. Weight loss is a huge one. Initially when people are diagnosed with Crohn's disease, they've generally lost a lot of weight because they're having a lot of malabsorption. They're not absorbing things. You may also have fever or joint pain. And the other thing is if you're going to the bathroom a lot, you may start to develop pain in the rectum, in the area of the anus, where you can actually develop little cuts we call fissures.
So when is it just, I mean, for example, diarrhea or belly pain as opposed to Crohn's? That's why this is so misdiagnosed. You hear from people saying, you know, I just have some pain, and sometimes the pain can be excruciating, but you don't think Crohn's.
No, and that's why I think people don't get diagnosed. If you're young and you're just having recurrent spells of diarrhea, why would you think any differently of it? And generally when young people say, Mom, I'm having diarrhea, they generally say, oh, it's something you ate, right? But the issue is that if these symptoms change to the point where you can't live your life, you're constantly having diarrhea, everything is upsetting your stomach, you're having fever, you're losing weight, you're just really not doing well, and you're struggling to keep weight on, these may be signs and symptoms you need to go to a primary care physician or a gastroenterologist and try to be formally diagnosed.